Good afternoon, everyone. Thank you for joining us for another one of our exciting informative webinars. Today's webinars, like all other webinars organized by Seva At Home, is an initiative to bring in expert medical advice based primarily on scientific facts. Our topic of the day today is protecting our children from COVID-19, a very crucial topic, an area of concern for all parents, grandparents, uncles, and aunts. And don't we want our little ones to be healthy and COVID safe? We're all facing the harsh possibility that COVID-19 can affect our children. And in the absence of an approved vaccine for children, what is it that we can do to protect them? To discuss this crucial topic and an area of concern, we have today Mr. Arun Datta, who's the COO of Seva At Home. And he will be talking to none other than Dr. Sanjay Wazir, who is one of the most well-known neonatologists and a pediatrician in Delhi NCR. Dr. Wazir is director of NICU, Cloudnine Hospital, Gurgaon. He has completed his MBBS, following which he completed his MD in pediatrics and DM in neonatology. So welcome, Dr. Wazir, and thank you, Mr. Datta, for taking on this crucial topic. We really look forward to listening to the expert advice on this topic. Before we start on this conversation, I would like to introduce Seva At Home as well. Founded in 2019, Seva At Home is a technology-enabled platform that offers comprehensive healthcare and support services to elders and convalescent in the safety of their own homes. Our company was created as a solution to the rising problem of insufficient healthcare facilities and lack of trained care providers. Seva At Home empowers family members and caregivers to engage with health and well-being of their elders, no matter where they are in the world. Founded by NRIs and anchored by a large partner network on ground in India, Seva At Home is led by a team of professionals who have extensive global experience in building value for all. I welcome all of you once again to this webinar, and I pass on the discussion now to Mr. Datta and to Dr. Sanjay Wazir. Thank you.
Thank you, Poonam. And before I begin it, I must thank Dr. Sanjay Wazir for really sparing his time to talk to all of us, to allay some of the fears that are going on in our mind as parents and as grandparents and as uncles and aunts, to really what is going to happen in case there is a possible wave which affects the children more than others. Dr. Wazir is one of those few doctors who is willing to give his time, a time which he's taking away from his patients, willing to give his time and talk to us and to share his knowledge, share his very specialized knowledge with all of us. So before I do anything else, thank you, Dr. Wazir. Would you like to say a few words, Dr. Wazir?
Thank you, Mr. Datta. It is a privilege to be here, and it's good to be connected to people for two reasons. One is that in the current era where you do not get to meet people, this is one of the fastest medium to connect and to be socially connected. And second is that, of course, with the advent of social media, there's so much rumors which keep coming up. So it's important that, there has to be some kind of a scientific knowledge which gets percolated across the population rather than just relying on, so many people coming and say, we read this on the WhatsApp. I said, let's, at least for our children, let's go and read a WHO report, read a UNICEF report. And let's not, believe a WhatsApp coming from a friend who could be as knowledgeable or as naive as us. So it's something which is close to my heart, and thank you for providing that opportunity.
So, Dr. Wazir, it is not just the social media. Whatever is happening on WhatsApp, of course, Facebook, we all know. But this morning, I was hearing on one very prominent TV channel, the All India Institute of Medical Sciences chief announcing that the next wave is inevitable. He says in so many words that the next wave is inevitable. It's only a matter of time, really. No, so therefore I really wanted to understand, is there some kind of a fear mongering that is going on by the social media and the mainstream media? Or is there a real scientific study behind this to say that the children are likely to be affected in the next wave?
So, answering the question, there are two parts to it. One is that is third wave going to happen or not, and that's the first part of the question that I would like to address. And given that there are mutations and kind of a genetic changes which is happening in the virus, and we saw that the second wave had the Delta variant, which was high, even more transmissible compared to the first wave. We are also talking about some genetic variation and talking of a Delta plus variant being, in circulation now. There is a distinct possibility of a third wave, so for sure. And unfortunately, we know whenever the lockdown opens and the number of deaths go down, the number of cases go down, our behavior completely changes. In fact, other day I was reading a newspaper headline which said that there is a jam from Shimla to Solan because people have thought that COVID is over and it's time to celebrate. Now, that kind of a behavior among our population, that's going to happen. When it is going to happen, it's something which is not really scientifically cannot be predicted. But if you say, based on the transmission rates and other things, possibly somewhere 3 to 4 months. But in UK, they saw a surge around 14 to 15 weeks after the second wave. The one wave died and the other came up. So it is going to happen. It's like, and given that we have still a large chunk of population which is not vaccinated, there is a distinct possibility that is going to happen. Now, answering the second part of the question, whether the children are going to be more affected than the adults. Now, we have no reason to believe that they're going to be affected more than the adults. In fact, and the data is based on two things. The one is that there was a recent study of seroprevalence, which means that you looked at the antibodies among the children and in the adults. And in some areas, they found the antibody protection among less than 18 and above 18 was almost only 10 or 15% difference, which means that in areas where they had a COVID significantly, the children were also affected. And most of them have had a protection level, which is enough for us to prevent a epidemic kind of a situation in children. And second, in the first wave or the second wave, the virus gains entry through an ACE receptor, which is technically less expressed in children. Now, percentage-wise, yes, the number of percentage as more children would have, more adults would get vaccination and the children would not get vaccination. So the percentage of cases may be more, but it's not that it's disproportionately going to causes. So you may say absolute number may not change, but the proportion may look different because the younger people would have had vaccination and the kids would not have had the vaccination.
Okay. But, I was reading somewhere, and this is entirely from a layman's point of view. It said that we human beings, we try to strive and thrive. Even the virus does it in a similar kind of a manner. And then what it does is that when it finds that a large population is immune because of either vaccination or because it has been affected earlier, therefore the virus mutates to find hosts in a section of population that has not been vaccinated or that does not have immunity. Is it right that mutations of virus also happen in a very intelligent kind of a fashion to be able to infect those sections of the society which are not vaccinated? Is that right?
So, answering that question, yes, survival is the rule of game for the nature, and every species finds ways to survive, and viruses are no exception. So you see it with the flu vaccine; it keeps changing its antigenic properties every year. So that's why you have a new flu vaccine every year. And that tends to, for some of the viruses are fixed, but most have a capacity to mutate and to be ability to survive kind of a different, host kind of a scenario. Now, when you talk about whether the children would be at a high risk because the virus would have mutated, and current vaccines as of now, for example, are reasonably covering most of the mutants which are available, number one. Second, children would only get infected if they come in contact with the adults who have had a disease. So if the adults are vaccinated and the adults kind of wear a socially appropriate behavior in terms of wearing a mask, not attending parties, not going to gatherings, obviously children are not going to be the first point of contact for people to get infected. So nobody's even today talking about opening schools. Nobody's about talking about sending children for picnics. So the only way the children can get affected is if there is a child which has come in contact with an adult who has an infection. But then the transmission stops there because that child does not go to a public place where other children are there. So the protection has to be at the family level for children to be protected.
What is very interesting is, and there is a question sent to me by a lady registrant, a lady called Smita Ambedkar, who says, how do you expect children to have COVID appropriate behavior, which means that if you have a 1 year or a 2-year-old toddler, how do you expect that toddler to actually wear a mask and go around?
So there are two things. Yeah, so obviously, because children are metabolically more active and they're like breathing at a faster rate, wearing masks may not be appropriate for very small babies, and there is always a choking risk for the small babies. Now, that's a very pertinent point you made out. But the other point that you need to see, why do toddlers need to go to public places unless they're going to the hospital, they're going to a place where, so you need to be making sure, again, that responsibility comes back to an adult saying that, okay, I do not want to go to a public place because I have a toddler.
Very well said, very well said. That at the end of the day, actually, it's the responsibility of an adult who takes a child to such a place where the child could be infected, really. There is a lady called Bindu Nair and a gentleman called Akash Datta who have asked me whether influenza shots are likely to be able to prevent the possibility of children getting infected by COVID. So do influenza shots help in the children?
So the answer to the question is influenza shots do protect, especially the smaller children and the adults in the family. Like, even older people should get an influenza shot every year. And unfortunately, most people do not comply with that kind of guidelines in India. But that is not with the purpose of protecting against COVID. So flu vaccine was there for so many years. So if that was so simple, then people would have gone for the flu vaccine to give COVID protection. So flu is a disease which is caused by an influenza A virus, which is completely unrelated to the coronavirus family. So protection against one does not give you a cross protection against the other one. So that's number one. But at the time, you want your children to be protected against all the diseases which can land up in the hospital for two reasons. One, that like from a public health point of view, you don't want children to occupy beds which are when others need it for COVID reasons, and other also you don't want children to go to the hospital simply because you are falling sick because of a vaccine preventable disorder. So that is the reason why some of the experts are suggesting that flu vaccine should be given to all as a part of a recommendation. Even in US, for example, they would say, okay, for every child less than 5 years, they needs to be given, and that is what Indian doctors are also following. Above 6 years, above 5 years, it was meant only for people who were in a high risk zone, like like somebody with the underlying cardiac, pulmonary, or a renal disorder or asthmatic child. Those are the children who should get an annual flu vaccine because influenza tends to be severe in them. But now the recommendation is that probably this year the children are, they don't want them to fall sick because of flu, so give a vaccine to all. Again, it's not a mandate from the government, it's just a recommendation.
Actually, your answer has brought me to a question sent by another lady called Yogita Shrivastava. She's talking about an underlying condition that her son already has. So she says, my son has allergy problems since childhood. Now he's 11 years. He starts sneezing and there's irritation in his nose whenever the weather changes. What precautions should he really be taking right now?
So again, this I'm not, since I've not examined, but from the history, I can make out she's suffering, the child is suffering from allergic rhinitis or the allergy of the nose, and that's why the child starts sneezing in the morning. Now, in many cases, the allergen is identifiable. In many cases, the allergen is non-identifiable. And many cases, children are allergic to multitude of stimuli from a strong perfume. So a general advice, I would say, you would probably want to look at things like perfume, agarbatti, dhoop, goodnight mat, all out, all those things which have generate a lot of aromatic odors. Those are the ones which can cause irritation in the baby or the child. And for example, if the child is there in the room and you start brooming the house, you will generate a lot of dust, and that can cause, if you have a pet in the house, and that can cause like an allergy to the child, and can cause animal or dander related allergies to the child. You can also look at probably sometimes you have indoor pollen plants, like flowering plants, and that can also cause this kind of you may be close to a construction site, and the window, when you open and it comes in, and of course weather change would bring in temperature changes, and then some children may be sensitive only to temperature change and no other allergen. So it may be a good idea to actually document whatever changes whenever your symptoms become severe. Make a diary and then take whatever changes have happened in the last 24 hours, and that may help you make a judgment about a clinical assessment about what your child is allergic to. But in case the symptoms are severe, then maybe you can talk to an allergy doctor, and then there are certain skin prick tests that can be done to find out whether the child has what kind of an allergy.
Oh, thank you. Well, I hope, Yogita, you've got your answers. I am also going to talk to Dr. Wazir on behalf of large number of young ladies in the country who are perhaps now expecting a baby. And I know that my own niece, Tania Malik, is also expecting a baby. And I know that that a lot of ladies would not only be tense about the childbirth, but also as to how are they going to protect a newborn baby from COVID. So, and there is another question sent to me by a gentleman called Rahul Bandole, who says, please guide us on care for in case there are premature babies who are born. So there are in fact two questions that I'm asking. One is, what does one do in such circumstances? There are premature babies. And also, what does one do really for ladies who are expecting a baby now to ensure that they don't pass on any infection to the newborn?
So basically, there are two things to this thing: whether that infection of the mother does have an impact on the baby or not. Now that's the first part of the question, and then the answer to that question is that yes, it does have, like whenever the pregnant lady gets COVID infection, there is a risk which increases slightly of a sickness level being higher than a non-pregnant female in the mother. And sometimes infections in the baby, in the mother, can actually lead to adverse pregnancy outcomes like abortions or even stillbirths or premature births. And this particular wave with what happened last month We had a flurry of babies who came with premature delivery because the mother had COVID and then they went into premature labor. And that's a concern that we think that in future also exists for us when the third wave comes. And that's so again, the protection is about protecting yourself from people who have a risk of transmitting the infection to you. So again, which means that, you know, doing things like baby showers and like, you know, celebrations around this thing should wait for things to you know, for pregnant ladies and going out. I understand it can be quite exhausting for women to be sitting at home and not going out and like, you know, because they are, but it's not the time to do that kind of adventure for sure. And in future, probably we have like, you know, there was a recent study from ICMR which suggests that the pregnant females should also get vaccine. We do not know when that gets licensed by the government, but whenever it gets, like, you probably would want to get a vaccine as a third layer of protection. But once the baby is born, like in that thing, again, you need to see there is a cocooning effect. There is like, you know, the infection the child is in a cocoon, and the surrounding the cocoon are people like father, the mother, the grandmother, the grandfather, and the persons who are going to take care. So number one, that you need to make sure that your children are protected against, your family is protected against all the diseases, like including flu. For example, grandparents should also get a flu vaccine so that the child doesn't fall sick to a non-corona illness as well, you know. And whooping cough could be another thing. So every 10 years, one is supposed to, maybe that's something because your company is looking after so many old people as well with Seva At Home. I mean, that's something, a mandatory 10-year Boostrix vaccine is to be given to all people who are more than, and pneumococcal vaccine, for example, all adults should get, like, and that is the kind of protection that we need to protect to all our family members. And the mother and father should maintain a corona appropriate behavior and not get into a celebratory mode so soon. And once you have a ring around the baby, which is of people who are not going to have or less likely to have an infection, you're less likely to do transmit, because even if the vaccine is available for children, it's not going to be available for children less than 2 years.
Oh, okay. So therefore, there is no way that you can protect, a baby who's less than 2 years in any case by a vaccine. And therefore, perhaps the only way around is for the people around, or as you said, the cocoon around the baby or the newborn baby or about to be born baby to be very, very safe. And therefore adults like parents, grandparents, uncles, aunts, everybody has to ensure that they are infection-free.
For sure.
Having said that, I mean, I don't think there is any reason for anybody to really be tense about it. Go ahead, Tanya, have your baby and enjoy him or her, whatever. I mean, whether you get a son or a daughter, go ahead and enjoy him.
No, in fact, the best thing to tell you on a positive side, you know, despite all those things, we never lost even one single baby. So that's very positive, you know, news with all the premature baby. And the youngest one was 650 grams. He's 1,200 grams now today. He's still in the NICU, but he's still there. So I would suggest that, you know, I hope none of you get the infection. But even if there is, you know, you still do not need to, as Mr. Datta said, not to get worried about it. Like, you know, the medical technology is good enough to handle all those kind of complications. But we sincerely hope and pray that none of this thing happens to any one of us.
I must add a word here, Dr. Wazir. I mean, out of my personal experiences with you, what happens with a typical parent or a grandparent is that they become very highly emotionally attached to their babies, to their children. And anyone like you who really looks after their children or grandchildren is almost next to God for people like us. And the confidence and the competence that you exude is too much. Thank you, Dr. Wazir. Thank you for whatever you're doing, really.
Thank you.
I will take a few more questions by some of the registrants. There is a gentleman called Jonathan Christine who has asked for vaccine availability and desirability of giving vaccines to children. Are there any vaccines available? If yes, when can we expect them to be available? And what should be really the age of a child below which we should not really give a vaccine? In fact, you have already said that perhaps below 2 years we should not, or there may not be a vaccine also. But go ahead,
because
please.
the current trial which is going on is in babies between 2 years to 19 years. So, and if it is not been tested in less than 2 years, and which is for obvious reasons, they're not going to test such small babies. So obviously that's something probably you're not going to get a government license on less than 2 years.
Okay. So vaccine availability is a big question. And even if it is available, whether it is suitable for a child less than 2 years, I hope, Jonathan, if you're listening to us, maybe you've got your answers. There are a lot of ladies, and I must name two of them, Saraswati Thapa and Smita Londe. They are asking as to what should really be a diet of a baby to be able to boost the immunity of a baby. What should really we be doing to ensure that our children are otherwise immune and their immunity levels are higher than what they really are as of today? So maybe food, maybe habits, maybe whatever else you suggest, please.
So, so I can, if I understood the question right, probably they're wanting to ask about the food, what can boost the immunity, like, right? Yes. So that's a very important question that you've been brought out, because immunity is the third commonest word in Google being searched right now in India. So immunity is a protection against a multitude of disorders. So it cannot be corona specific. So you need to look at how nutritionally we can replete our children enough to keep an immune system working appropriate, so that just in case, God forbid, they have an infection, they can fight it out. Okay, so so that's the idea, but you can't really make a corona specific immunity just by a diet. So number one. Number two is like, so how do you do and what do you do? Because there are supplements available, like, nowadays, because I think the most people have abused zinc and vitamin C and so many things, and I'm sure like multitude. But to give you a parental perspective, as a pediatrician, as a father, my children have not received zinc and vitamin C. So that's why. So I can understand. You can understand that the futility of what most of us were doing at that point of time. The best way for you to get immunity is like, because it's not, the body does not take into account that today I want zinc and tomorrow I want vitamin C, and then it's a multitude of all the minerals and micronutrients, you call them in nutrition, that is appropriate for us to be giving our children the right kind of a immune system so that they can fight any infection, be it COVID, be it non-COVID. Right? So as far as the macronutrient is concerned, we need to ensure that they get at least 1 to 1.5 grams of a good quality protein. For a vegetarian, it could, for a non-vegetarian, it could be chicken, fish, egg, and other things as well. And for vegetarian people, it could be paneer, it could be tofu, it could be, of those vegetarian people who take egg, they can have egg, or even peanut powder or peanut butter, or maybe like chickpeas. And there are multiple other sources of protein. That's one that we need to keep our immune system working fine. And predominantly, we need to look at fresh fruits and vegetables, and the vegetables which are either sauteed or are like steamed, like, so overcooking the traditional Indian way of eating may kill many of the micronutrients you are actually looking for example. So having a diet which contains 50% of your plate with fruits and vegetables, 25% with protein, and rest 25% with grains is something which is the most nutritious at any age. And traditionally, we start with having dal and roti, and we say roti and sabzi khali, but that doesn't give you enough micronutrients. So what I suggest to the parents as a routine is that, like, if you're looking at a nutrition of a child, you choose, and how do you know what food to be given? Like for vitamin C, vitamin D, and that's not something which is practical that you need to give. I'm eating this for zinc and this for selenium and this for calcium. So you choose a day, like for example, Monday could be a red day. So that day you probably can give tomatoes and berries and, like, anything of that called. Then the second day could be an orange day, for example, where you give like a carrot or a mango or a pumpkin, or like, so these things. By the time, if you have at least 4 different colors in a week, you will be completely protected against most of the diseases which are going to be happening because of lack of nutrient. Because micronutrient deficiency is quite common in India, and one of the major reasons for people to develop infections more than the Western people.
Wow, that is a very, very good suggestion, Dr. Wazir, to just look at colors of various foods, right? And take a particular color on a particular day. And I suppose this particular suggestion that you are giving is perhaps applicable not just to children, but also to adults.
For sure.
To pick up a particular color and eat fruits of that color only for a particular day, and then perhaps go to the next day with a different color.
So it also not only make sure that you have all the kind of because you may have orange, which is more rich in vitamin C, but you may have, like, something else which is rich in, say, zinc. So for you to know the balance on a daily basis is not practical possible. So this is one of the ways you can do it. And other way it is that it makes things at home fun. Like today, the children get excited. Today is a red day, so I'm going to have this thing. So it brings a fun element to eating, rather than a mundane way of, like, mother chasing the baby and saying, "Ki, aaj ye khana kha lo." वो बेचारा कहता नहीं खाना है. Like, so it's kind of a.
I know. I know. As a grandparent, I face it almost on a daily basis. that I run after my granddaughter with some amount of food that she doesn't want to eat.
Yeah.
Okay, let me take one or two very specific kind of questions that have come. There is somebody called Ankur Sinha who says, my baby is 6 months old and he's suffering from what is called lactoenzyme. What can I add to his diet to protect the child from COVID and from lactoenzyme?
So I think, like, the question is, he may be suffering from a lactase enzyme deficiency. If I'm correct in interpreting this question. So lactase enzyme is normally present in babies as to digest the milk, and the lactase is a form of a carbohydrate which is present only in milk. So one of the ways that the child is already 6 months, you can start with a non-milk diet, like, food, which we just talked about the fruits and everything. And the child would not have that lactase coming in from any other source. It's only from the milk. So that's one way you can, make sure. And otherwise, commercially, there are lactase enzymes available, which you can add to the milk before serving to the child in case that is required. But again, as I said, it's important that you need to get variety of the diet inside. So only milk-based diet is not something that is good for the child to develop, different taste and to have a variety. So probably getting fruits, getting, proteins, and getting, like, other grains into the diet at 6 months is much more useful. And for 6-month child, apart from this, like, there is no specific corona-specific food that, again, as I said, there is none which is available as of now. Otherwise, everybody would know about it by now, because the information spreads fast these days.
Dr. WhatsApp would pass it on to us before.
Oh, of course, like, at least it will generate, if not.
Yes. There is another very important question asked by a lady called Jyoti Nagappa. And this is a very relevant question for everybody. Those people, especially those parents who are working outside the home, Those of us who are able to work from home, of course, we are a little more fortunate. But those who have to go out of their homes to work, what should they really be doing to protect their children from COVID?
Yeah, so the prime example is me, because I have children, two children at home, and me and my wife both go to work in a hospital where you have corona symptoms. So everywhere. So this is a question which does not have, unfortunately, a direct answer that you can actually do. What you should make sure that you make sure that you wear appropriate kind of a protection, whether it is a double mask, whether it is like, looking at the patients, screening them, like not come in contact with people who are likely to be infected, and seeing them from a distance. So I mean, all of those things are practically possible, and this is not something which only the parents can do. Of course, like, the organizations have to pitch in as well, like, to understand that those parents who have less than 2 years age group children may just, for their children, for example, those parents, they can be allowed a flexible working schedule, and they can work. So it's a more of a management kind of question, but from a parental point of view, the answer would still be the same: wear appropriate mask. And one of the things that we do is, like, we change our shirts every day, but many times I've seen the same mask we use by people to every day, and they touch it here. So I would just say, if you pass on the infection, just make sure that you're using the mask correctly. It's not only wearing a mask, it's using it. Like, I can't touch it every day and then touch my eyes and then, like, go and touch something else. So that's something which is, use a sanitizer at home. The moment you reach home, you probably take a bath, dump those clothes which are there, which you are wearing, and dump them in and wash them in an appropriate, separate, which you do not mix with the children's clothes as well. And for most of the times, it may be practically difficult, but when the positivity rate is high, and at that point of time when you still have to go home, maybe maintaining a distance at home, also not trying to hug the children, especially for those children who are slightly older, and maintaining a fair distance. And surprisingly, children are very intelligent these days, so it's the adults who are making mistakes. So I had today, one and a half year child coming, and she said, wanted to check her. So the moment I would remove the mask, she'll put it back, and the moment she'll put it back, so I could understand that's a corona baby who knows what to do. Like, but it's for us to learn that.
I know, and the other day I noticed when I'd gone out for some work, I had noticed a lot of ladies wearing a mask made of the same fabric as their dress. And
Yeah.
I thought that here perhaps the fashion has become a little more important than the actual quality of the mask, which can protect you from the disease. So it has almost become a fashion to wear a mask with the same shade or the same color or the same cloth as your dress.
Sure. And most of them are not like those are cloth masks. They are not N95 masks, which are going to protect you.
Yes. A colleague of mine at Seva At Home, Sandeep Bahari, he asked me whether even if the schools are open tomorrow, is it advisable to send the children to school?
See, I think that's unlikely happening when the COVID rates would go up. The government lockdown would automatically shut the schools, and the children are the first one to be stopped. But again, then you have to take, in case that does happen, the schools open and the children have to go to school. So unless there is real emergency, I would suggest that there's no reason for us to be, at least for a younger children who are like 4, 5, 6 years, all that can be learned at home, and there's there's nothing huge they're going to miss out. For children who are into 12th class, 11th class, maybe in that scenario you need to talk to the school authorities, make sure that they do not intermingle, although it's practically not possible. It's easier said than done. But maintaining a 6 feet distance in the classroom, if it is such a dire emergency that for people to go, especially for 11th or 12th or 10th class students. But for younger children, I mean, I would stay away from sending children to school at that point of time. But then that's purely a personal opinion.
Okay, Dr. Wazir, I'm going to shift the gears now a little. And while we have talked of how to prevent, and we've also talked about whether the fear is real or is not real, and we have also talked about the fact as to how should we really be preventing our children. But unfortunately, suppose our children do get infected in the days and the weeks to come. Here are a few questions that I wish to ask on the treatment of the disease in case our child gets infected by it. Now, first of all, are the symptoms of the disease in the kids exactly the same as that of an adult, or are they going to be different?
So
And
the
this is,
symptom, sorry,
sorry,
please.
sorry, this is somebody who's called Pramila Shukla who's asked me this.
Yeah. So Pramila, the question, the symptoms in children are going to be exactly more or less the same: the fever, the cough, the cold, and then like sometimes children have slightly more incidence of GI symptoms like vomiting, loose motions, compared to adults. That's the only difference we know as of now. But if the corona develops into a corona COVID pneumonia, so COVID infection is kind of an asymptomatic infection or an infection which is largely restricted to the upper respiratory tract. But if it goes into the lower respiratory tract, like which is called a COVID pneumonia, and which is where all of us are fearful of, then the child would start breathing with a little huffing and puffing. Maybe you can see the chest ribs, like there is a chest indrawing, and there is a kind of a nasal flaring. And if you have a chance to check with the pulse oximeter, you may find a low oxygen. But as of now, we understand in the first or the second wave that not much, that children did not have too many of these symptoms as far as COVID pneumonia. Most those who had COVID were largely either asymptomatic, as the seroprevalence study showed, which we just talked in the initial part, or they would have symptoms which are more likely like cough, cold, fever, and then settle down. Now, the only other symptom complex, which is slightly different from adults, is like what is known as the MISC, or multi-system inflammatory syndrome, which is specifically a multiple organ involvement in children, and generally seen not at the time of COVID, but around few weeks after the COVID has happened. Like, and so this child may have looked like improved completely from COVID, but he has a recurrence of fever or starts having a rash, has like a recurrence of vomiting, loose motions, and you may find those children having cardiac involvement with heart rate being high. So that's a rare entity, but obviously all of us should be aware of that in case any of our friend children or our children have got infected, so that in case we do not neglect that fever and take an immediate consult with a doctor to find out if this is MISC or not.
Oh, that sounds a little scary.
Yes, like medicine is that's how medicine is. But at the same time, as I said, it's a rare phenomenon. But obviously, if you know about it, you're not going to miss it. Like, it's not about creating a fear. It's an information that one must know, all of us, that fever, recurrence of fever, especially if it is persisting for couple of days after, if the child has had COVID and recovered from it, should not be taken lightly and adhere to that point.
No, I know. See, speaking out of my own experience in healthcare, of course, I'm not a doctor, so I don't understand medicine part of it, but I understand the patient behavior. And I have seen this myself, that if you unfortunately have a health problem, right, and if you don't go to a doctor, you're likely to do yourself a very big harm, because from what I understand about it, if you go to a doctor and talk about your symptoms to a doctor, he or she may be able to give you a solution. And if you have a problem, you may get a solution. And if you go and talk to a doctor and the doctor says you don't have a problem at all, then either way you emerge as victorious, because you feel that you have had a problem, but the doctor tells you that you don't have a problem. And if you do have a problem, then the doctor offers you a solution. So either way, please go to a doctor and talk to the doctor, and I'm sure you will get a solution. There is a question that I wish to ask to Dr. Wazir, and that is in respect to what we are doing at Seva at Home, of providing healthcare at home. Now, in adults, there were a lot of guidelines about quarantining people at home and taking care of people at home or the patients at home. Would the requirements of quarantining children at home, would they be very different? Should we really be asking for those oxygen concentrators to be kept at home? Should we really be keeping some kind of equipment at home? What would be different in case of taking care of a child at home? What should we really be prepared for?
So answering the question, see, from an equipment point of view, you need maybe a thermometer to keep checking the temperature. You may need a pulse oximeter to check for an oxygen saturation, because the problem would be very small children, less than 1 or 2 years. The application of pulse oximeter, the routine which is available in the market, is not, since they are not medical grade. So one, the reliability is questionable, and because they're prone to motion artifacts. So once the child, keeping them still is a difficulty. So you probably can check when the child is sleeping, but sometimes there's a problem. But if you can get a hold of a pulse oximeter, that is something that you need to be kind of doing. Oxygen concentrators, to be honest, I did not see a role in the management of COVID. It is good to have as a kind of a safety device, so that at least allays your fear. But if you are in sending phase of a corona infection and you have an oxygen requirement, then you would probably end up going to the hospital because once it progresses and goes on to the corona, most of the children would need some kind of a support, which is other than only the oxygen. And you may require oxygen concentrator for a descending phase. So somebody has gotten hospitalized and now it's coming back to the home, and then you probably needs a little bit of an oxygen. So it's good. But having said that, we had scarcity of oxygen this time. So if you have an access to one, maybe not a bad idea to keep one, at least, if not for each family, but at least for the locality, or for your community, or or a couple of people put together, having one, because all of you not going to require it at the same time.
Okay. What are the drugs that are likely to be prescribed in case children get affected by it? And we saw in the last wave that there was a severe shortage of drugs, and the drugs were being black marketed. Are the drugs that may be required for children going to be different, or will they be the same drugs? Do you know if they are going to be available or not?
Yeah, since COVID is a new disease, and we are all gone through the cycle of using hydroxychloroquine and then discarding it. We started with remdesivir, and then we discarded it, tocilizumab, and then we discarded it. So we understand in a new disease, this is going to be how it is. People are going to try in some way, claim success, and then we do it in a larger number of patients. You may find it doesn't work. And with the Delta variant, the monoclonal, combination therapy also doesn't seem to be working in the new Delta variant as well. So as of now, I think hospital-wise, maybe it's also the additional support which is more important than just the drug. So medicine, you go to the hospital, it is not only for getting a drug only. So you get support for your blood pressure, you get a support for your liver, for your kidney, for all of the things, nutrition and other things. So a supportive care is an important part of the COVID care. And that is something that is saving more lives than drugs. In fact, drugs have not saved any life, and that is the reason remdesivir, despite being black market, being available only in the black market, now after 1 month it's been discarded into a dustbin, with this thing. So it's all those people who have survived because of the good intensive care thing in the first place. Now, for people at home, children, if they get infected, so it's it's like any other flu symptoms. So you may just want to give support for controlling fever, like crocin, like Meftal, and or ibuprofen for controlling the fever does not come down with crocin, and controlling the flu symptoms with any antihistamine. And many times you would have seen doctors prescribing antibiotics, but just one. Like, I saw an adult prescription which had like 3 different antibiotics, like, and that kept on, so I thought that's probably overkill. But just one, because many times what you presume, because most of the times corona patients are taking a video consult, so we end up prescribing some kind of azithromycin or one or the other antibiotics, because we do not know whether the symptom is like because of an upper respiratory tract infection because of corona or something else, till the results come out. And apart from that, routine things are of no value. Like, there's no complications that you need to be worried about. And if they get into complications, whatever it is like at that point of time, which is the WHO mandates, that of course that will be available. Shortage of drugs is a problem, and I don't know, see how far we can go with it. But as I said, most of these drugs have not shown to show any benefit in terms of this thing. So do not get overtly. And one of the things which I tell parents or patients is like, when you go to the doctor, don't ask the question, doctor, is something to be worried? Ask the question, okay, how many percentage of cases this drug has been shown to be effective? What is the the rationale that you are prescribing this drug? If you ask scientific questions, you will get scientific answers. If you ask questions which are a little vague, you'll probably get, okay, this is, and plasma therapy, this happened, everybody started looking for plasma donors all over the place. And today, again, ICMR says, okay, it doesn't really work and you do not need to do so. Why did we have to go through that exercise? Again, because it was human tendency to do something. So if I tell some patient on a very lighter note and say, okay, is there a medicine for corona? I said, no, there's no corona medicine available. So doctor, kuch to dena hi padega na. So I mean, then if that is the kind of this thing, so I say, okay, theek hai, you take this. But I'm sure that prescribing behaviors from the doctors and patients owning the responsibility for their own health is an important part to make the system work better for which will be a win-win for both for the doctors and the patients.
Well, another colleague of mine from Seva, Prince, had asked exactly the same question. Prince, I suppose you've got your answer. One last question, Dr. Wazir. There are some questions that are coming in through our Q&A mode also. There are a large number of participants who are asking these questions. But just one last question before I go into the questions that are being asked now, is about the infrastructure and facilities available in the country to be able to treat children if they get really infected by this. So, we heard that oxygen was not available, or hospital beds were not available, and the infrastructure was far short of what it really should have been. Is there anything being done about the infrastructure now to take care of kids in case they get infected?
Mr. Datta, the one thing that you answered, you have made one big hospital like Medanta, and then you've been consultant to so many. Making a hospital is not an overnight that you can do it in in 2 months or 3 months. It's much more than that. And the healthcare is not only about providing the infrastructure, it's also about creating doctors. So if you had, like in India with the population where you had 2,000 patients and 1 doctor, suddenly overnight you can't make that 10 doctors reach. So you're probably making nursing students come and do the job, and the MBBS students, but that cannot create a world-class infrastructure. And even if it was US, it was Italy, it was any other country, the health system with the kind of a pandemic we had and the kind of surge in cases we had, we always are going to fall short of beds whenever the waves come, right? So it's like as long as the positivity rate remains low, we're able to manage like right now. If God forbid anyone gets COVID, he will get a bed all the time. But the surge, no government in the world would be able to kind of provide that kind of infrastructure if the surge is beyond a capacity for infrastructure to handle. Now, which means, is the government not doing enough? Yes, it is doing enough. It is creating, pediatric centers. It created like COVID centers also, and it, gave orders for ventilators. It started sourcing oxygen from all over the world. Okay, that's the government's part. Like, but in the first place itself, it is the responsibility of the society to make sure that COVID does not reach a level where it is going to reach the last time. So if we say, okay, we want to protect our children, then we must ensure that people make sure that we do not cross our limits as far as the social distancing is concerned, break the barriers which allow the corona to spread in the first place. And that is the biggest single thing that you could do for yourself, your family, and the society. And the government obviously would take care of the infrastructure needs as such. But if you say, okay, there is, suddenly pediatric COVID beds coming up all over the place, there are not enough pediatric intensivists to you, which can be created overnight.
So some of the questions that have come to me live is a gentleman called Santosh Shalgaonkar, who wants to know, is it okay to use an N95 mask more than a day? So if I have used a mask today, can I use it tomorrow as well?
So, there was the AIM study which suggests that you could use it for four times. But what is like, you use an N95 mask, but you can keep it in the sun so that it can dry. Don't use the same mask tomorrow also. And there is a specific way of, you could probably see a YouTube video on how to wear a mask and how to remove a mask. So it's like, so infection doesn't happen because you're wearing the same mask again. It's like, I touch it here and then I touch it here and then touch it again. And then, do not wash my hands in between. I probably will get an infection. So it's more to do with the sensitivity around using the mask correctly rather than, but one thing, the mask with a respirator is something that is not right. So you should not believe and that's, I've seen many people using that.
So Saraswati Thapa has again asked about supplementary tablets, multivitamins, tablets, etc., which we already have discussed with Dr. Wazir. Nisha Mahindra wants to know, due to the pandemic, we haven't visited doctor and routine vaccinations are pending. What should we really be doing?
So a very important question, because corona is there, rest of the viruses and bacteria have not gone into hiding. So that that's something which one must realize, that if we delay the routine vaccination, then you would probably end up with a cohort of babies once the lockdown opens, and then they will be susceptible to other diseases as well. In fact, WHO had reported last year that 117 million children are at risk of having measles compared to across the world because of this pandemic, because they have not gotten vaccinated because of various reasons. Either the parents did not opt for, or the government structure did not, or the government machinery fell apart. But so many children at risk of having a measles outbreak. And measles, corona has a mortality of less than 1%. Measles has a mortality of 4 to 10%. Okay. So, which means that it is 10 times deadlier than this thing. So, I mean, this is a message that I probably want to put across to all the parents. You would probably should vaccinate all your children, because other diseases also are there and they're going to be not, going away. So now the parents have the question, so how do we make sure that we don't get a corona at the clinic? Now, most of the doctors would have done is that either they divided the clinics into a morning and evening schedule, where the morning they attend to only the sicker patients, or vice versa, and evening they tend to people with
with only the vaccine needs, for example. There are other clinics like ours. We started a home vaccination drive where people would consult a doctor on video, and then the prescription get generated, and the nurse would come home, and in the ambulance the child would be given a vaccine so that the parents do not have to come to the hospital for that reason. Third is that utilize in this disease you're going to have troughs and the peaks. Now the peak is over right now, so this is the time you want to catch up on your vaccination, like again. But and a little bit of sensibility about making sure that Saturdays does tend to be crowded for most people. So don't go on if you want to be going to a public place or a hospital, don't go on a Saturday. Like choose a day, take a day off, and make sure that you go in the leanest part of the day, which could be an afternoon, which could be a late evening or whatever, so that okay, that day you're less likely to contract an infection. So, but vaccinations are a must, and especially for children less than 6 months, and for two things. Then if you have a very bad injury, then a tetanus should not wait, even if it's a peak of corona. And if you have been bitten by a street dog whom you do not know, and that is the time you should go irrespective of corona.
Oh, yes. So, I mean, not to get overawed by corona and ignore other problems. Well, we are running out of time. In fact, we have run out of time, but some of the questions that have come to me, in fact, have already been answered. Dipesh Thakkar wants to know about vaccines, which we have talked about. Gauri Shankar wants to know about symptoms in the kids and adults. We already have talked about this. So I will ask my colleague Poonam in case there are any questions left. Poonam, would you like to answer any questions? You won't find Dr. Wazir so easily available.
No. So I am happy to answer any email which might come up later. So in case somebody has missed out on asking a question, because I feel, it's the time for us to spare some time for sure for the society, and all of us are equally responsible. I should be responsible to do that.
I must compliment you on this sense of service to the society. There are, I mean, I've interacted with doctors for the last 4 decades. I haven't found too many doctors who are that society conscious and are willing to serve the society. So thank you for what you are, Dr. Wazir. Poonam,
thank you for the kind words.
Poonam, please, in case you think any questions are left or should be asked.
There is one question which is from there's no name to the person who's put the question, but he's asking that his baby is 2 months old and totally on formula milk. And is that a good way in terms of good nutrition to protect the child from COVID-19?
See, all we know is that the breastfeeding is the best way to have the protection against any disease. Leave aside the corona, but even if you have to protect your child against diarrheal diseases, air infections, and other multitude of other, so benefits of breastfeeding are numerous. And formula would obviously be a second choice for any child, whether there's corona or not corona. Now, having said that, if you have a mother has had a vaccine, that the antibodies will pass on to the baby. So that's another benefit that you have from a corona perspective. If the mother has corona, the WHO currently says that still that mother has an option to continue with breastfeeding or an express breastfeeding, even in an active stage of having a disease, because so much is the benefit which has been ascribed to to the breastfeeding, that even mother with the corona positivity should be breastfeeding the child. Now, for reasons which are beyond personal control, sometimes the mothers may not have enough milk, or for one or the other reason the breast milk is not available. Formula continues to be the second best choice after the breast milk.
Great. So I think we've taken too much of your time, Dr. Wazir. I would just like to thank you for providing clarity on so many topics that we've covered today. And we really appreciate your inputs and hope that everyone will take away the key points that you've highlighted and For me, the two key points really are, number one, how important it is for us adults to understand our responsibility and ensure that our little ones are kept in a safe environment away from COVID. And also the second very crucial point, which we discussed towards the end, was scheduled vaccinations should not be ignored for a little baby. And you did suggest that there are hospitals that are now providing a way of providing vaccination at home. And of course, ideas on going to clinics and hospitals when it's quiet and safe for families to go. So thank you so much, Dr. Wazir, for talking to us and talking to everybody who's attended the webinar. Seva at Home team wishes everyone a happy and a healthy life. Stay safe and ensure that your children are safe. Thank you. Thank you, Mr. Datta, and thank you.
Thank you, Poonam. Thank you, Dr. Wazir. Thank you.
And thank you, Mr. Datta, and thank you, Poonam, for providing me this opportunity. I'm sure we're going to have one more webinar next year, or maybe sooner than that, celebrating the end of Corona. So we're going to meet again soon.
Yes.
Yes, yes. Okay. Thank you.
Sure.